Hi guys, good morning. This is Dr. Behnam, one of the founders of Happy. Thank you so much for joining my office hours. We had a really good one last week, and we have a lot of patients joining this week and asking a lot of questions. So please submit your questions, and I'll be more than happy to answer them as we go along. Um, so I'm going to start basically by reading the questions and then I'm going to answer it. I'm told if the scalp is bald, you cannot stimulate hair growth. So I mean, it's yes and no. So if you're complete bald and there's absolutely no hair there, yes. I mean, there's no hair to stimulate hair growth. I mean, in that case, you need a hair transplant. However, if you do have some peach fuzz hair or you're thinning, this is where Happy Head really shines because it could basically reverse the miniaturization of those hair follicles and stimulate the growth of those hair follicles. Should I account for high testosterone levels as a reason for I'm losing my hair? So a lot of patients that are actually losing their hair, when they check testosterone level, they have normal testosterone level. Now, if you happen to check your levels and you do have high testosterone levels, that may be the cause, but majority of patients actually that do lose their hair, they have normal testosterone levels. So then the question is going to become, then why is it that do people lose their hair? Well, it's still testosterone, but the more important part is that it's the affinity of that testosterone to your hair follicles. So some patients genetically are predisposed to have a high affinity. So even if you have a very little amount of testosterone, that testosterone is going to bind and cause miniaturization. Whereas some patients genetically don't have a very high affinity. So if you have a lot of testosterone, you're still going to basically keep your hair. Hi. Another patient said, my question is determining how much to apply solution to the head if you're applying to just the crown area versus larger areas. That's a great question. Typically, we say that you should apply 1 ml twice a day. So if you have a small area, you're still going to apply the 1 ml twice a day. You have a big area, you're just going to spread it basically more. Obviously, if you have a small area that you're applying that 1 ml, you're going to hit it harder compared to applying it all over the scalp. So you might see better results, but we just don't want our patients to go beyond that 1 ml twice a day. Can thin hair grow thicker with your product? Yes, that's the whole point. The reason why hair thins out is because testosterone causes what we call miniaturization, which means the hair follicles shrivels basically over time. So what finasteride does is basically it blocks the enzyme that converts testosterone to DHT, which is responsible for miniaturization. So when you have thinned out hair, which means you have miniaturized hairs, and by using the topical, it can reverse that miniaturization. Um, I've been taking finasteride for over 10 years. Should I stop taking it while using this topical solution? So that really depends between you and also your doctor. So we have a lot of patients that are on both. And when you typically add a topical to your regimen when you were taking oral finasteride for many years, it actually makes the oral finasteride work a little bit better in my personal clinical experience. So when you're oral finasteride for 10 years, you're going to start to plateau and it's just not going to work as well as it did basically in year one. So when you add the topical, it's just a different route of applying it. So that's what makes it work better. If you're not on any of them, you should start probably on topical and later on you could add an oral as long as you don't have any side effects. If you're on oral and you don't have any side effects, you could certainly add the topical. I've had thyroid issues since my teenage years. I'm almost 65 years old and I've had a total thyroidectomy in 2003. Do I really have a chance of regaining a full head of hair that I've lost all my life? It's really not related to your thyroid. So thyroid does affect basically obviously your hair, but more importantly is the level of miniaturizations and how much hair you have totally lost. So you could have thyroid issues all your life, but if you still have a lot of peach fuzz hair, using the product could actually help you. You could have normal thyroid basically levels all your life, but if you're complete bald and you lost all your hair follicles, the product is not going to help you. So I would say if you still have some hair and some peach fuzz hair and you're not completely bald, then it's worth trying it. I get some leg edema with minoxidil use. Does this go away with time? So minoxidil is one of the side effects. Minoxidil is an oral blood pressure medication that could cause some swelling in the legs. It's actually pretty rare. And but if you do get the leg swelling, I will probably stop the minoxidil and do not use it. That usually does not go away with time. So just please reach out to us, and we'll be more than happy to take the edema, basically, to take the minoxidil out of the solution, so you don't have the edema anymore. Also, with respect to minoxidil, the most common side effects of minoxidils include irritation on the scalp, which basically we talked quite extensively last time about it, and we'll talk a little more. And also, some patients could have some heart palpitation, which is also normal. That usually goes away. Some patients might have some swelling or darkness underneath the eyes. If that happens, let us know. We'll be more than happy to reduce the minoxidil concentration or take it away as well. One of our patients on Instagram asked the question that I've been using dutasteride with microneedling. Um, Started to fill in my bald spots. So far, so good. So that's great. I'm glad to hear that. Thank you for sharing basically your results. Yes, topical dutasteride and finasteride are both some of the products that we do sell. And if you do use it with microneedling, you're just going to have better results. So we do encourage our patients to use microneedling. I think it's very important. Does the concomitant use of tretinoin and minoxidil increase absorption of minoxidil? Yes, it is based on a clinical study where basically they did minoxidil alone by itself, and patient had to do it twice a day. And then when you add tretinoin, you only have to do it once a day, and the clinical results were the same. So basically, it shows that the tretinoin increases absorption of minoxidil, and you get better results. So, and this is why we do have tretinoin and retinoic acid in our formula. Which is better, finasteride or dutasteride? Excellent question. So Happy Head, we started out initially by offering topical finasteride, but now we offer both topical finasteride and topical dutasteride separately. So in clinical studies of oral dutasteride versus oral finasteride, dutasteride was a better product. The reason is because dutasteride inhibits two enzymes that are responsible for DHT formation, whereas finasteride inhibits only one enzyme responsible for DHT formation. And also, one of the studies showed that dutasteride is 100 times, it has 100 times more affinity in blocking one of those enzymes compared to finasteride. So dutasteride is turning out to be a much better molecule. And if you feel using finasteride and you're not seeing a success with it, we could certainly switch you out to dutasteride. After 3 months of using Happy Head, I'm seeing results. Great. My question is, when I achieve my desired results, is there a maintenance dose, or do I need to apply it twice a day? That's a great question, and that's something, honestly, that patients, no one really knows. But from my clinical experience has been that when patients kind of go on a maintenance dose, you start to lose some of that effect. So our recommendation is to still keep doing it twice a day moving forward, unless you're having side effects or issues, at which point then, you should cut down to minimize those side effects. After a couple weeks of using Happy Head, the skin on my scalp became irritated and broke out in small lesions. They went away when I stopped. Is this normal? Am I not a good candidate for the product? So Happy Head has 3 ingredients in it. It's finasteride, minoxidil, along with tretinoin. The minoxidil and the tretinoin basically could sometimes be irritating. So what you're describing, the irritation, the scabbiness, a lot of those basically is mainly due to the minoxidil. So it doesn't mean you're not a good candidate. It's just the fact that we could help you to reduce some of that irritation. And also, please realize that some of this irritation could also happen with the over-the-counter version as well. So my recommendation is this. If you're getting irritation from it, certainly stop for a couple of days and restart again. Instead of doing it twice a day, maybe you wanted to do it once a day. If that doesn't help, you could basically, after an hour applying it, basically you could wash off the product. So you could still use it twice a day, but wash it off after like an hour or two. If that doesn't help, you could use a leave-in conditioner. You could buy leave-in conditioners online. It's a conditioner that you put on your scalp as a last step before you leave the shower, and you just leave it in, and that's just kind of moisturizing your scalp. You could also just use a scalp serum or scalp moisturizer, and that will help you basically as well. If none of those help, then we could take the minoxidil and the retinoic acid out of the solution and ship you another one, and to see if that solves the problem. Is there a safe way to use the product during if your partner becomes pregnant or later on if she's breastfeeding? If not, what are the alternatives? There are no safe ways of using the product if your partner is pregnant or breastfeeding. Please do not use it. The alternative is one, do nothing, or two, basically you could go on oral finasteride during that period of time. Since I've been using this product, my scalp is sensitive and I also have flaky. Is this normal? Yes. Again, I'm going to refer back to a question I answered 2 minutes ago. It's normal to have flaky scalp. Um, Again, use a scalp serum, use a scalp leave-in conditioner, try to washing it out after an hour or two, try to cut down from twice a day to once a day. If none of those help, please reach back to us at help@happyhead.com, and we'll be more than happy to take out the retinoic acid and reduce the minoxidil concentration for you, and we'll ship you out a new bottle for free. We are here to take care of you guys, so please just let us know. Hi, my question is determining how much to apply the solution to a head. I see we already answered that question. I'm just going through some of the questions. Can women have both male pattern baldness and female pattern baldness with significant hair loss in the temple areas along with thinning throughout the scalp? Yes, unfortunately, I see this all the time. You could have females that have a widow's peak and also basically thinning in the frontal scalp. Yes, it could happen. Again, for females, we have the option of topical finasteride and also, I'm sorry, no, the option of topical minoxidil and also the option of topical spironolactone. You also have the option of oral spironolactone as well, but some patients may not want to do that. If you're female above age 50, you could also have the option of topical finasteride. Your doctor basically will let you know if that's a possibility for you or not. Are head massagers good for you? Honestly, there are no clinical studies that show head massage actually help you. However, we know that derma rollers basically do help. Um, Sorry, someone on Instagram said that there's no voice. No sound. I'm sorry about that. We're trying to fix it right now. I prefer derma rollers. I mean, they're kind of like scalp mini massages, but they actually create tiny holes in your scalp that could help you quite a bit. That could help quite a bit. So I prefer derma rollers as opposed to massagers. Guys, give me 1 second. We're trying to fix our audio on Instagram. I apologize. I do not know why I don't have audio. Sorry, guys. I apologize. I'm going to hand over this to our assistant, Eric. So instead of head massagers, basically, I would prefer to have basically derma rollers. I like the derma rollers that's 0.25. Wet the scalp, derma roll gently for a few minutes. That's better than any massager, honestly. So if dutasteride is better than finasteride blocking DHT, why not start with it? Yes, you could. When we started Happy Ed, the topical dutasteride was just not an option, but now it is an option. So yes, we could definitely basically switch you over out to dutasteride if you like. Just please reach out to Happy Head. What product or devices do you recommend for microneedling? Where can I get it? So you could just get it on Amazon. I just like the regular microneedle. It's called Derma Roller. Is the 0.25. It's about $10 to $15 on Amazon. There's also some mechanical ones. There's one called Dr. Penn. We are not affiliated with them. I'm not affiliated with them at all, but I think they do a pretty good job. What do? You wet your hair and basically just derma roll for a few minutes, and that just gives you a little bit better results. What are your thoughts on laser caps? That's a great question. So in clinical studies have shown that laser caps do stimulate hair growth. And we have them in our office. We have a big laser cap machine in our office. I think clinically, when patients use it at home, I just feel sometimes it might not be as effective. I'm just saying my personal opinion. I'm not saying they're bad, and I definitely have patients that come in and they swear by it that look, it does work, which is great. I don't think it's a make it or break it, but if you have it and you want to use it, and I think that's fine. I don't think it's gonna hurt you. So, any downside to Finasteride or Finasteride? That's a great question. So, when you look at the clinical studies of dutasteride versus finasteride, um, there's something known as what's called the half-life. The half-life of finasteride means how long it takes for that drug to leave your body. So the half-life of finasteride is around like 4 to 6 hours, which means in about 24-hour period, when you take the oral pill, about a good 90% leaves your body. With dutasteride, the half-life is about 5 weeks. So basically, if you take one pill, it takes for you basically to get rid of 90% of that material out of your body. It takes basically, honestly, like it's about several months, 2 to 3 months. um so and this was one of the reasons why a lot of doctors, or like long time ago, originally would not prescribe dutasteride, because the fear was if you had side effects, basically, then it would last longer. But in the recent studies, none of those studies actually pointed out that if you do have the side effects, basically the side effects do last longer. And we've noticed that the study that clinically, topically, basically has lower side effects than oral anyways. So right now it's kind of become like a mute point, but that was one of the reasons why some doctors were kind of somewhat worried about dutasteride. Another reason was because dutasteride was always very expensive. I mean, it used to be almost $1,000 for a 30-day supply, and it's gotten just much cheaper. And now and it's gotten to cheaper to a point where now we could make it topically, and it's affordable for our patients to afford it. So, but this used to be a very expensive drug, and it's only been recently that it's become a little more affordable. Thank you, Eric. Guys, that was Eric, our vice president of operations. Thank you, Eric. Um, so one of my patients on Instagram said 1 month in, I see and feel it working. That's great. Thank you so much for sharing that. That's great. The 1 month, guys, is a little bit early, honestly, to see results. But I'm happy that's working. Remember, everyone's different. So some patients will see results after a month, but a lot of patients typically have to wait that 4 to 6 months for you to see results. The key is patience, and persistence, and being consistent about it. Does Happy Head help to regrow hair if you have signs of frontal fibrosing alopecia? So frontal fibrosing, for people that don't know what it is that it is a form of scarring hair loss, where it's an autoimmune condition where the body attacks the hair follicles and basically kind of destroys the hair follicles. Male pattern, female pattern hair loss is not a form of scarring hair loss. Frontal fibrosing is very tough to treat. Thank you, Eric. It's very difficult to treat. Um, and so we don't, it's usually not indicated. Happy is not indicated from frontal fibrosing hair loss, but it doesn't mean you can't use it and see if it works for you or not. In my practice, I will tell you there are patients that have it and are using it, but again, it's not clinically indicated. Another one of my patients said, had hair transplant. I'm a happy head. I have great results. That's great. I'm still taking oral every other day as well. Is this safe, doctor? Yes. Yes, it is safe. We have a lot of patients that are both under oral and topical medication every day. As long as you're not having any side effects, I think you're fine. So that is not a problem. Is it okay to mix oral finasteride and topical dutasteride? Um, so I'm just going to talk in general amongst basically all dermatologists. In general, yes, there are doctors that do it. Again, as long as you're not having side effects, the answer is yes. We actually have a product where we have a topical finasteride and topical dutasteride together. We call it the kitchen sink. But yes, you could do oral finasteride and topical dutasteride. As long as you don't have any side effects, it's fine. Again, I do not recommend starting simultaneously both together. But if you're on one of them for about 2 months or 3 months and no side effects, you're more than certainly welcome to start the other one. And then you do need a prescription, so the doctor has to approve on it. At your last visit, you recommended 1% ketoconazola shampoo. I purchased Nigel and insist to use it 3 to 4 times a week for up to 8 weeks. Do you have any recommendations about usage? Also, can I recommend good men's hair conditioner? First of all, thank you so much for tuning in again to the office hours. Yes, we typically recommend using the shampoo about 3 to 4 times a week. I mean, I do not recommend shampooing every day. I don't think that's a good idea. You could shower every day and wash your hair every day, but don't shampoo every day. If I wouldn't have an end date to it, 8 weeks. Um, so you could just use it 3 times a week. I mean, unlimited. I mean, there's no problem. Um, I don't really have any recommendation for now for men hair conditioner, but Happy Head, we are coming out with a really good hair conditioner that has biotin and collagen. Is designed specifically by our team, and we should be coming out with that soon. So hopefully we'll release it as soon as that's available. Um, can topical finasteride have the same similar side effect as oral? Yes, the answer is yes, it could. Uh, if you read the clinical studies, and by the way, on our blog, we have basically reviewed all the clinical studies out there, so it's available and you're more than welcome to read it. If you look at the studies of topical finasteride versus oral finasteride, um, side effects will still happen. It's just at a lower risk. So still have to be careful, but it's just low risk. We should use Happy and a serum. Yes, a hair serum. So if you're getting irritated, you could basically use a hair serum, just like a hair scalp serum that will reduce some of that irritation. Sorry, I was just reading the questions. I'm new to the product. There's a follow-up question from a previous answer. Is this a lifelong commitment? Would I need to apply twice a week for the rest of my life? That's a great question. So usually with a lot of the hair stuff, it is a lifetime commitment. I mean, once you start with oral finasteride, you have to take it all your life. Otherwise, the effect is going to go away. There are some patients that once they start taking the topical after 6 months, they're seeing great results. Yeah, you could cut down to maybe once a day, and that's perfectly fine. And if that maintains it, then that's great. Or even some other, like once every other day, and if that maintains it, that's great. But you start to feel shedding once you cut down, then you could basically go back basic on the regimen again. So that's a very great question. Thank you so much. Are there other DHT blockers like azelaic acid, caffeine, saw palmetto equally as effective as finasteride? In clinical studies, nothing is as effective as finasteride. Um, However, if you use other stuff in combination, you could have better results. And this is why we mix our finasteride with minoxidil and retinoic acid. We are coming out with a shampoo that does have saw palmetto and keratins and biotin basically, so you could supplement the happy head with it. But again, in from a medical perspective, finasteride is more effective than really anything else, at least based on clinical studies. How often should I be using a dermal roller? We recommend using a 0.25% dermal roller basically every night. Basically wet the hair and basically dermal roll afterwards. Uh, I've had so a patient asked, I had worsened anxiety symptoms and mood with dutasteride. Should I try finasteride? So, and I'm not sure if this patient is asking about uh, our dutasteride or oral dutasteride, but dutasteride and finasteride, one of the rare side effects is that it could cause anxiety and depression. It's rare, but it's been reported. So our recommendation is um, that if you're having side effects on those side effects on dutasteride, do not try finasteride. You're probably going to have very similar side effects. Because I'm just reading the questions. Somebody said, where are we located? We are located actually in Los Angeles, California. We're right outside of Santa Monica. So a patient said, hello, sir. Recently, I've called Happy. Since my wife is pregnant, Happy recommended not to use any topical solution. And that is correct. We don't want Basically, look, pregnancy for us is the most important thing, and we just don't want to interfere with that, and we do recommend that please do not use any happy head products if your partner is pregnant. If one is taking oral dutasteride, is there much value in adding topical finasteride or dutasteride or topical dutasteride? That's a great question. Is yes and no. I mean, it depends. We do have some patients that once they go on oral dutasteride, they wait 4 to 6 months. If you feel you're getting the results you want, then that's perfect. You don't have to do anything else. If you feel that you could see better results, then you could add the topical dutasteride or finasteride. And at that point, basically, please reach out to reach out to us, and we'll chat to your doctor, and basically we'll get the prescription rolling for you. These are all great questions, by the way, so I really appreciate you guys asking these questions. So I think one of the questions, so I've been using, so another one of the patients said, I've been using finasteride for over 2 years, and I haven't grown any new hair. What are my options at this point? So, this patient is talking about oral finasteride. So if you've been using oral finasteride for 2 years and you haven't seen any hair growth, one, I will try to add topical finasteride, see if that's gonna make a difference. If that makes a difference, then that's great. And I've seen this where patients were in the same exact scenario and adding topical that help. Number two, if that doesn't help, then we could switch you out to either topical dutasteride or oral dutasteride. And if then that doesn't help, then probably you need to see your doctor basically in a consultation, and possibly adding oral minoxidil to your regimen might be the right thing to do. Okay, I'm just reading through some of the questions. Again, this dermal roller question keeps coming up. I just want to go over them one more time. We love dermal rollers. Some patients have told me that they use dermal roller on their scalp at 1.5 millimeter depth. Honestly, in my opinion, I think that's a little bit too deep. Our recommendation is use the 0.25 millimeter depth and wet the hair and basically roll it and then apply happy head on top of it. Another question that comes all the time is that my scalp is flaky and irritated from the topical. And if that's the case, again, either first of all, please reach out to us and we'll be more than happy to send you all this in a video or basically in written instructions. But you could use a hair scalp serum where you just basically moisturize it. You could wash the product out after an hour. You could use it once a day as opposed to twice a day. Or if none of those help, you could also use a leave-in conditioner as well. And if none of those help, then reach out to us. We'll be more than happy to remove the retinoic acid from the product, or lower the concentration of minoxidil, or even remove the minoxidil from your product and ship you out another one. Our goal is for you to be happy and to use the product. So just reach out to us and we'll take care of it for you. Can thin hair grow thicker with your product? Yes. The reason why you have thin hair is because testosterone gets converted to DHT and it miniaturizes the hair follicles. And by having miniaturized hair follicles, clinically it shows as thin hair. So what our product does is a testosterone blocker. It prevents testosterone from converting to DHT, and as a result, that reverses the miniaturization. In addition, the minoxidil and the retinoic acid in our product increase the blood flow to your scalp, which washes out the DHT that's already there. So all that help basically with improving, basically reversing the miniaturization and causing hair growth. Have you heard anything of the value of using capsaicin for topical use? So capsaicin is a topical product that's used in dermatology if you have intense itch. I've never seen it used for hair loss. First of all, once you apply it, it really burns quite a bit because capsaicin is actually derived from pepper. It's a pepper product. So I don't think most patients would like to have that product on their scalp. And I really don't know much about it. Do you offer a topical that has both finasteride and dutasteride. Yes, it's called the kitchen sink. We do offer it. It's currently on our website. If I could have Eric, our vice president, our patient, send you the link to it, or you could probably post the link as well. We offer topical finasteride products mixed with minoxidil. We also offer a separate topical dutasteride product mixed with minoxidil, and then we offer a product called the kitchen sink, which is topical finasteride fortified with topical dutasteride mixed with minoxidil. Again, I'm gonna answer one of the questions here. Somebody had said earlier on that if they're complete bald, does happy head work? It's not. You need some hairs for happy head to work. You need to have thinned out hairs for it to work. So if you're complete bald, unfortunately, it's just not gonna help. But if you have thinned out hair, basically, then it is going to help. Trying to read the rest of the questions. Somebody said, "Is our product vegan?" Unfortunately, our product is not vegan. No, but it's also not made up from anything from um, meat or dairy. So I guess it could be considered vegan. Eric just posted our kitchen sink link. That's the all-in-one solution. And I'm just looking through our Instagram, see if there's any other questions. Okay, guys, so I think that's all the questions there are. Well, thank you so much for joining us on another office hours with Dr. Ben. I really appreciate it. If there are any questions, please let us know. We are here to help you guys out. Send us an email at help@happyhead.com. And we also have our promotion as well. So please, if you haven't signed up, please use our promotion for 60% off as well. Have a beautiful day. Again, please feel free to reach out to us. Have a nice day. Bye-bye.